Yeah, we typically do not do screening or genetic screening at the initial diagnosis. Absolutely, we want to have all patients ultimately tested for at least Lynch syndrome, which is associated with a change in mismatch repair proteins. So at our institution, we usually do this on the hysterectomy specimen, but it is certainly possible also to do this on the initial endometrial biopsy from either an office endometrial biopsy or a DNC, and already get that initial screening done. So that's an important one for future therapies, but also to diagnose patients or screen a patient if they could have this endometrial cancer as part of Lynch syndrome. Then they can use preventative measures for family members, but also preventative measures for other malignancies that they may develop over or are at risk for over their lifetime.
Unfortunately, we don't have a screening test similar to a pap smear for endometrial cancer. So that's why it's important for us to pay attention to early symptoms like we've already talked about, the abnormal bleeding, postmenopausal bleeding. We can identify a few patients at risk who have been previously identified through our genetic counselors and genetic screening as a consequence of other family members having some sort of cancer. But again, we don't have a screening test to help us yet prevent endometrial cancers. If we pay attention to symptoms, we're going to find the vast majority of those endometrial cancers.